Tell me a bit about yourself and why you are interested in becoming a clinical support worker.
Thank you for the opportunity to tell you a bit about myself. My name is Mihira, and I am a highly motivated and compassionate individual with a genuine interest in healthcare and patient well-being. For the past 2 years, I have been volunteering at a local community care center, where I assisted elderly residents with daily activities, provided companionship, and helped create a comfortable and supportive environment for them. This experience was incredibly rewarding for me as it allowed me to witness firsthand the positive impact that dedicated and caring individuals can have on people's lives, especially when they are vulnerable or in need of support. It was during this volunteer work that I realized my strong desire to pursue a career where I could directly contribute to patient care in a more hands-on and clinical setting. The role of a clinical support worker particularly appeals to me because it offers a fantastic opportunity to work closely with patients and the nursing team, providing essential practical and emotional support that directly enhances patient comfort and recovery. I am eager to learn from experienced healthcare professionals, develop my practical skills in a clinical environment, and contribute to the smooth running of the ward, ensuring patients receive the best possible care and have a positive hospital experience. I am a quick learner and a dedicated team player, and I possess a strong work ethic and a naturally caring nature, all of which I believe make me well suited to excel as a clinical support worker at your hospital.
Can you describe any previous experience you have, paid or unpaid, that is relevant to this role? This could be in healthcare, caregiving, or customer service.
While my previous formal employment has been in the retail sector, working for 3 years as a sales assistant at Sunrise Department Store, I believe this experience, along with my volunteer work, has provided me with a strong foundation of transferable skills directly relevant to the clinical support worker role. In my retail position, I developed excellent communication and interpersonal skills through constant interaction with a diverse range of customers daily. I honed my ability to actively listen to customer needs, understand their concerns, and provide helpful and empathetic assistance, even in sometimes challenging or pressured situations. For instance, I frequently assisted elderly customers with their shopping, offering extra help with carrying items, finding specific products, and ensuring they felt comfortable and supported during their visit to the store. This customer-facing role also required me to work effectively as part of a team, collaborating with colleagues to ensure smooth store operations, manage stock efficiently, and provide consistent and high-quality customer service. Beyond my paid work, my volunteer experience is even more directly relevant. For the past year, I have been volunteering at Harmony House, a local residential care home for individuals with dementia. In this role, I directly supported residents with their daily living activities, including assisting with mealtimes, mobility around the home, and personal care tasks such as washing and dressing, always ensuring their dignity and privacy were respected. This hands-on experience has given me practical experience in providing personal care, understanding the needs of vulnerable individuals, and developing essential skills like patience, empathy, and the ability to follow instructions and care plans set out by the senior care staff. Both my retail and volunteer roles have instilled in me the importance of clear communication, teamwork, providing compassionate support, and being reliable and responsible, all of which are crucial attributes for a clinical support worker. I am confident that these experiences have equipped me with a solid skill set and a genuine understanding of the caring environment, making me well prepared to transition into and succeed in this role.
What do you understand to be the main responsibilities of a clinical support worker?
From my understanding, the main responsibilities of a clinical support worker are centered around providing essential support to both patients and the wider healthcare team, always working under the direct supervision of registered nurses and other qualified healthcare professionals. I understand that a key part of the role is to assist patients with their daily needs, focusing on their comfort, dignity, and well-being. This would involve tasks such as assisting with personal care, including washing, dressing, and toileting, helping patients with their mobility around the ward, ensuring they are comfortable and safely positioned in bed or chairs, and assisting with mealtimes, encouraging nutritional intake, and providing support with feeding if required. Beyond personal care, I also understand that clinical support workers play a vital role in monitoring patients' basic observations, such as taking and recording temperature, pulse, blood pressure, and respiration, accurately documenting these observations and promptly reporting any changes or concerns to the nursing staff. Furthermore, I believe a significant responsibility is to contribute to maintaining a safe and clean ward environment. This would involve tasks like ensuring patient areas are tidy and well-maintained, making beds, changing linens, restocking supplies, and assisting with infection control measures, such as cleaning equipment and following hand hygiene protocols rigorously. Crucially, I understand that clinical support workers are integral members of the team and play an important part in ensuring the smooth running of the ward. This involves effectively communicating with nurses and other healthcare professionals, promptly and accurately relaying patient information, and assisting with various non-clinical tasks as directed by the nursing staff, which might include things like escorting patients to other departments, collecting specimens, or preparing equipment. Overall, I see my main responsibility as being a proactive and reliable member of the team, dedicated to providing compassionate and practical support to patients and assisting the registered nurses to deliver high-quality and efficient care, always working within my scope of practice and under their direct guidance and supervision.
What skills do you think are most important for a clinical support worker to have?
In my opinion, several skills are absolutely essential for a clinical support worker to be successful and provide high-quality support. Firstly, compassionate communication skills are paramount. This role is all about interacting with patients, often when they are feeling vulnerable or unwell. Being able to communicate clearly, empathetically, and respectfully is crucial for building trust, understanding patient needs, and providing emotional support. This includes active listening, using clear and simple language, and adapting communication style to suit individual patients, who may have different levels of understanding or communication abilities. Secondly, practical care skills are vital. Clinical support workers are directly involved in assisting patients with their personal needs. This requires competency in practical tasks such as assisting with washing, dressing, mobility, and feeding. However, it goes beyond just performing the task. It's about carrying out these duties with sensitivity, respecting patient dignity and privacy at all times, and ensuring patient comfort and safety during every interaction. Thirdly, teamwork and collaboration skills are incredibly important. Clinical support workers are integral members of the healthcare team, working closely with nurses, doctors, and other healthcare professionals. Effective teamwork means being a reliable and supportive colleague, communicating clearly with the team, following instructions accurately, and contributing to a positive and efficient working environment. Being able to take direction, understand roles within the team, and contribute to shared goals is essential. Another crucial skill is observation and attention to detail. Clinical support workers are often the ones spending the most time directly with patients and are, therefore, well placed to notice subtle changes in a patient's condition. Being observant, paying attention to detail in patient observations like vital signs or changes in behavior, and accurately reporting any concerns to the nursing staff are vital for patient safety and early intervention. Finally, responsibility and reliability are key attributes. Nurses rely on clinical support workers to carry out delegated tasks effectively and dependably. Being punctual and responsible and consistently following through on assigned duties ensures the smooth running of the ward and that patients receive timely and consistent care. Furthermore, it's crucial to be reliable in maintaining patient confidentiality and adhering to ethical and professional standards in all aspects of the role. In summary, the most important skills for a clinical support worker are a blend of compassionate communication, practical care abilities, teamwork, keen observation skills, and a strong sense of responsibility and reliability, all underpinned by a genuine commitment to patient well-being.
How would you ensure a patient's privacy and dignity while assisting them with personal care, such as washing or dressing?
Ensuring a patient's privacy and dignity is absolutely paramount in all aspects of care, especially when assisting with personal tasks such as washing and dressing. My approach would be guided by respect for the individual and a commitment to maintaining their sense of self-worth throughout the interaction. Before commencing any personal care, would always ensure that privacy is prioritized. This means, first and foremost, closing the curtains around the bed in a multi-occupancy room or ensuring the door to a single room is fully closed. I would also be mindful of any visitors and respectfully request that they step out of the room for a few minutes to allow for privacy during personal care, explaining that this is to ensure the patient's dignity is maintained. I would always explain to the patient what I am about to do before starting any task. This involves clearly and simply explaining the procedure, whether it's a bed bath, assisting with dressing, or any other aspect of personal care. Giving the patient this information beforehand allows them to feel more in control and less anxious about what is happening. Crucially, I would always ask for the patient's consent before beginning any personal care. Even for routine tasks, it's vital to ensure the patient is comfortable and agrees to the assistance. I would phrase this as a clear question, such as, would it be alright if I helped you with your wash now, Mr. Harry, and respect their decision if they decline or wish to postpone. During the personal care itself, I would focus on exposing only the area of the body that is being washed or dressed at that moment, keeping the rest of the patient's body covered with a sheet or blanket to minimize unnecessary exposure and maintain modesty. Throughout the process, I would maintain a calm, gentle, and professional demeanor, speaking to the patient in a respectful and reassuring tone and being mindful of my body language to ensure it is also respectful and non-judgmental. I would encourage the patient to participate in the care as much as they are able and as comfortable as they are, promoting their independence and sense of control. This might involve asking them to wash themselves as much as they can, guiding their movements gently, or allowing them to choose clothing items where appropriate. Throughout the care, I would be attentive to the patient's verbal and nonverbal cues. If they express any discomfort, embarrassment, or wish to stop at any point, I would immediately respond to their needs and adjust my approach accordingly, ensuring their comfort and emotional well-being are prioritized. After completing the personal care, I would ensure the patient is comfortable, properly redressed, and repositioned in a way that respects their comfort and dignity. I would ensure the privacy curtains or door remain closed until the patient indicates they are ready for them to be opened again. In essence, my approach to personal care is always rooted in treating each patient as an individual, respecting their personal space, preferences, and feelings, and ensuring that their privacy and dignity are upheld throughout every step of the process, creating a safe and comfortable experience for them, even when they are in a vulnerable situation.
Imagine a patient is feeling anxious and upset. How would you approach them and try to offer support?
If I encountered a patient who was visibly anxious and upset, my primary focus would be to create a safe and supportive space for them and to try and understand and address the source of their distress. My initial approach would be calm and gentle, ensuring I approach them in a non-threatening manner. I would first ensure my own safety and the safety of the patient and surrounding environment, quickly assessing for any immediate risks. Then, I would approach the patient slowly and deliberately, making sure not to startle them. I would use open and non-threatening body language, maintaining a relaxed posture and open hands, and approaching from the front so they are aware of my presence. Once I was close enough to communicate, I would speak softly and calmly, using a gentle and reassuring tone of voice. My opening words would be empathetic and designed to acknowledge their emotional state without making assumptions. For example, I might say something like, "Excuse me, I can see you are feeling upset. Is everything all right? Or I've noticed you seem a little anxious. Is there anything I can help with?" It is important to use simple and clear language, avoiding medical jargon that could further confuse or alarm them. I would then actively listen to the patient and allow them to express their feelings without interruption initially. It's vital to give them the space to voice their concerns and not to rush in with solutions before understanding the problem. I would maintain good eye contact, if culturally appropriate and comfortable for the patient, nodding to show I am listening and paying attention to their verbal and nonverbal cues. To show empathy and validate their feelings, would use verbal cues of understanding. This might involve phrases like "That sounds really upsetting, I can understand why you might be feeling anxious right now," or "It's completely understandable to feel this way." Validating their emotions helps to build rapport and trust, making them feel heard and understood. Once they have had a chance to express themselves, would then gently try to explore the underlying cause of their anxiety or upset. This would involve asking open questions such as, "Can you tell me what's making you feel anxious?" or "Is there anything specific that's worrying you?" I would listen attentively to their response, trying to identify the specific triggers for their distress, which could range from pain, fear of the unknown, loneliness, confusion, or unmet needs. Depending on the cause of their distress, would then try to offer practical support or solutions within my scope of practice as a clinical support worker. If they are anxious about a practical issue, such as waiting for medication or feeling uncomfortable, I would try to address these issues directly, for example, by checking on the status of their medication with the nurse or helping them adjust their position for comfort. If their anxiety seems to be more emotional or related to their condition or treatment, I would offer reassurance and simple, clear information if appropriate, always being careful not to give medical advice outside of my role. I could reassure them that they are in a safe place and that the team is there to care for them, and I could offer to get them a drink or make them more comfortable. Crucially, I would also recognize my limitations and know when to escalate to a registered nurse. If the patient's anxiety is severe, persistent, or seems to be related to a deeper clinical concern, I would immediately inform the nurse in charge, providing them with a clear and concise summary of the situation and the patient's expressed concerns. The nurse would then be able to assess the patient further and implement more advanced interventions if needed. Finally, after interacting with the patient, I would document my observations and the interaction clearly and concisely in the patient's notes, recording the patient's emotional state, the interventions I attempted, and any further actions taken, including informing the registered nurse. This ensures continuity of care and allows the rest of the team to be aware of the patient's emotional needs and any ongoing concerns. In essence, my approach would be patient-centered, focusing on creating a calm and supportive environment, actively listening, validating their feelings, trying to address the cause of their distress within my scope, and always knowing when to seek further help from the registered nurse to ensure the patient receives the appropriate level of care and support.
How would you explain a simple procedure, like taking blood pressure, to a patient who is feeling nervous?
If I needed to explain a simple procedure like taking the blood pressure of a patient who was feeling nervous, my approach would be all about reassurance and clear, straightforward communication. Firstly, I would approach the patient with a calm and friendly demeanor, ensuring I have warm and approachable body language. I would introduce myself clearly and confirm their name, using their preferred title, to establish a personal connection. Before even touching the equipment, I would start by acknowledging their nervousness directly and empathetically. I might say something like, "I understand you're feeling a little nervous about having your blood pressure taken, that's completely normal, or lots of people feel a bit anxious about this, please don't worry." Acknowledging their feelings right away can help to build trust and make them feel more comfortable. Then, I would explain what blood pressure is in very simple, non-medical terms. I would avoid jargon and use analogies that are easy to grasp. For example, I might say, "Think of your blood vessels like pipes that carry blood around your body, and blood pressure is just how strongly the blood is pushing against the sides of those pipes. It's just a way for us to check how your heart and blood vessels are working. Keeping the explanation basic and relatable helps to demystify the procedure and reduce anxiety associated with the unknown. Next, I would describe the procedure itself, step by step, in a clear and reassuring way, highlighting that it is quick and painless. I would explain each stage as I am about to do it so there are no surprises. For example, I'm just going to put this soft cuff around your arm now. It might feel a little bit tight for a moment, just like a hug on your arm, but it won't hurt at all. Then, as I inflate the cuff, you'll feel it get a bit tighter now as it gently squeezes your arm, but it's just temporary, and then it will quickly release. When deflating, now it's going to get looser, and that's it, almost done. Breaking down the procedure into manageable steps and explaining each sensation helps to alleviate the fear of discomfort. Throughout the explanation and the procedure, I would maintain eye contact and a reassuring tone of voice. I would encourage them to relax their arm and try to breathe normally, as being tense can sometimes make the reading slightly higher. I would also ask if they have any questions before, during, or after the procedure, encouraging them to voice any concerns they may have. For instance, do you have any questions about that at all? Please just let me know if you feel uncomfortable at any point. Finally, once the blood pressure is taken, I would tell them the reading in a straightforward and non-alarming way, unless there is a reason for immediate concern, in which case I would inform the nurse immediately. If the reading is within a normal range, would simply say something like, "Okay, all done. Your blood pressure is looking good/normal, reassuring them that everything is fine. If the reading is slightly outside the normal range, would avoid causing alarm and instead say, "Your blood pressure is 130 millimeters of mercury." The nurse will review this as part of your overall checkup, again, keeping it simple and avoiding any medical jargon that might increase your anxiety. The key is to make the whole experience as calm, comfortable, and understandable as possible, directly addressing their nervousness and empowering them with information in a reassuring manner.
What would you do if a patient asked you a question about their medical condition that you didn't know the answer to?
If a patient asked me a question about their medical condition that I genuinely didn't know the answer to, my priority would be to ensure they received accurate information from the right person while also being honest and helpful within my scope of practice as a clinical support worker. Firstly, I would be honest and acknowledge that I don't know the answer. It is crucial to be truthful and avoid guessing or making up information, as this could be inaccurate or even harmful. I would say something like, "That's a really good question, Mr. Franklin, but I'm afraid I don't have the specific medical knowledge to give you a proper answer on that. I'm not entirely sure about that, I wouldn't want to give you incorrect information." Then, I would clearly explain that as a clinical support worker, it's not within my role to give medical advice or detailed explanations about medical conditions. I would gently clarify that these types of questions are best addressed by the registered nurses or doctors who are directly responsible for their medical care and have the full picture of their condition and treatment plan. For example, I might say, as a clinical support worker, my role is to assist with your daily care and support the nurses. Questions about your medical condition are best answered by the nurses or doctors who are overseeing your treatment, as they have all the details and are the most qualified to give you that information. Crucially, after stating my limitations, would immediately reassure the patient that I will absolutely find someone who can answer their question accurately. I would emphasize that their question is important and that it's right for them to want to understand their condition better. I would say something like, "But it's really important that you get a clear and accurate answer, and I can definitely help with that. Let me speak to your nurse right away and ask them to come and talk to you about this. Would that be all right?" This shows I am taking their question seriously and am proactive in getting them the information they need from the appropriate source. Immediately after this interaction, my next action would be to promptly inform the patient's registered nurse about their question and their anxiety or need for information. I would provide the nurse with a clear and concise summary of the patient's question and their emotional state, so the nurse is fully informed and can prioritize addressing the patient's query in a timely manner. I would say to the nurse something like, "Mr. Harry in bed 20 asked me about medication side effects and seemed quite keen to understand more. I explained it's best answered by you and said I would let you know so you could chat with them when you have a moment." Finally, I would, if appropriate and possible, revisit the patient after speaking to the nurse to let them know that I have passed on their question and that the nurse will be coming to speak with them soon. This follow-up reinforces my commitment to helping them and manages their expectations about when they will receive the answer they are seeking. It also shows that I have taken their request seriously and acted upon it. In summary, when faced with a medical question I couldn't answer, my approach would be to be honest about my limitations, clearly direct the patient to the appropriate healthcare professional, reassure them that their question is important and will be addressed, and proactively ensure that the registered nurse is informed and can provide the patient with accurate and comprehensive information. This way, I am being helpful and supportive within my role, while ensuring patient safety and access to correct medical advice remains the top priority.
Describe a time when you had to work as part of a team to achieve a goal. What was your role and what did you learn?
A time where effective teamwork was crucial to achieving a positive outcome was during a particularly busy period at Harmony House, the care home where I volunteer. We were organizing a special afternoon tea party for all the residents to celebrate the home's anniversary. This was quite a large undertaking involving all staff and volunteers. The goal was to create a joyful and memorable occasion for the residents, many of whom have limited mobility and varying cognitive abilities, ensuring everyone could participate and enjoy the celebration safely and comfortably. My specific role within this team effort was primarily focused on resident support and practical assistance. I was responsible for liaising with the care staff to identify residents who needed extra help with mobility to and from the communal lounge where the tea party was being held. I assisted in safely escorting these residents, using wheelchairs and walking aids as needed, ensuring their comfort and dignity throughout the process. I also helped set up the lounge area, arranging tables and chairs to be accessible for residents with mobility challenges and ensuring the environment was safe and welcoming. During the tea party itself, my role was to assist residents with their refreshments, offering drinks and food, providing assistance with cutting food for those who needed it, and most importantly, engaging in conversation and providing one-on-one support to ensure each resident felt included and enjoyed the social interaction. I worked closely alongside the care home staff, other volunteers, and even some family members who came to help. Communication was key. We had a quick team briefing beforehand to allocate roles and responsibilities, and we constantly communicated throughout the afternoon to ensure everything ran smoothly. For instance, if a resident became tired or overwhelmed, we would quickly communicate this to ensure they were moved to a quieter area or offered a break. From this experience, I learned several valuable lessons about teamwork. Firstly, I realized the power of clear communication and pre-planning. The initial briefing and constant updates during the event were crucial for ensuring everyone was on the same page and working effectively towards the shared goal. Secondly, I understood the importance of clearly defined roles and responsibilities, but also the need for flexibility and adaptability. While we each had assigned tasks, we were all prepared to step in and help each other out when needed, especially when unexpected situations arose, like a resident suddenly feeling unwell. Thirdly, I deeply appreciated the value of diverse skills and perspectives within a team. The care home staff brought their expertise in resident care and safety, the volunteers provided extra hands and enthusiasm, and family members brought their personal connection and understanding of their loved ones. Combining these different strengths made the event far more successful than any of us could have achieved individually. Finally, and perhaps most importantly, I learned that effective teamwork is truly rewarding, especially when it directly contributes to the well-being and happiness of others. Seeing the smiles on the residents' faces and the positive atmosphere of the tea party, knowing that our collective effort had created this enjoyable experience, was a very fulfilling and motivating outcome. This experience solidified my understanding of how essential teamwork is in a caring environment and reinforced my desire to work in a role where collaboration and shared goals are central to providing excellent care.
Are you comfortable with following instructions from nurses and other healthcare professionals? Tell me about a time you followed instructions to complete a task.
Yes, absolutely. I am very comfortable with following instructions from nurses and other healthcare professionals. In fact, I understand that diligently and accurately following instructions is a core part of the clinical support worker role, and it's something I take very seriously. I recognize that nurses and other healthcare professionals are responsible for the overall care plan and patient safety, and my role is to support them by carrying out delegated tasks reliably and effectively, always under their supervision. A specific example of a time when I followed instructions to complete a task effectively comes from my volunteer work at Harmony House Care Home. One afternoon, a registered nurse, Sister Patel, instructed me to assist Mrs. Evelyn, a resident with limited mobility, with her afternoon exercises. Sister Patel provided me with very clear and specific instructions, explaining the series of gentle exercises that Mrs. Evelyn needed to do to maintain her joint mobility and circulation. She demonstrated each exercise to me, emphasizing the correct technique to ensure Mrs. Evelyn's safety and comfort, highlighting the range of motion Mrs. Evelyn was able to manage, and specifying the number of repetitions for each exercise. She also clearly explained important safety precautions, such as being mindful of Mrs. Evelyn's balance, ensuring she was seated securely throughout, and monitoring her for any signs of discomfort or fatigue during the exercises. Before commencing the exercises with Mrs. Evelyn, I made sure I fully understood all of Sister Patel's instructions. I clarified any points I was unsure about, asking Sister Patel to re-demonstrate a couple of the exercises to ensure I was performing them correctly and safely. Once I was confident, I carefully followed Sister Patel's instructions step by step while assisting Mrs. Evelyn with her exercises. I ensured Mrs. Evelyn was comfortable and understood what we were doing, explaining each exercise to her simply and clearly, just as Sister Patel had shown me. I paid close attention to Mrs. Evelyn's responses throughout, constantly checking if she was feeling any pain or discomfort and adjusting the exercises according to her feedback and Sister Patel's guidelines. I carefully monitored her breathing and fatigue levels and ensured I was supporting her safely and securely throughout each movement. I completed the exercises exactly as instructed, ensuring the correct number of repetitions and range of motion for each, and provided encouragement and positive feedback to Mrs. Evelyn throughout the session. After completing the exercises, I reported back to Sister Patel, informing her that the exercises had been completed as instructed and providing her with feedback on how Mrs. Evelyn had tolerated the session, noting any observations I had made about Mrs. Evelyn's mobility or any comments she had made during the exercises. Sister Patel was pleased that the exercises had been carried out accurately and safely and that I had effectively communicated with her about the task completion and Mrs. Evelyn's response. This experience, and many others during my volunteer work, reinforced for me the importance of attentively listening to instructions, clarifying any uncertainties, following instructions precisely and reliably, prioritizing patient safety and comfort, and effectively communicating task completion and any relevant observations back to the supervising nurse. I am confident in my ability to consistently follow instructions accurately and diligently as a clinical support worker, contributing to safe and effective patient care under the guidance of registered nurses and other healthcare professionals.
Give me an example of a practical task you are good at. How do you ensure you complete tasks accurately and safely?
One practical task that I feel confident and competent in is assisting patients with their mobility, specifically helping them to transfer safely from their bed to a chair and back again. During my volunteer work at Harmony House, I frequently assisted residents with these transfers, and I learned the importance of proper technique and attention to detail to prevent falls and ensure the comfort and safety of the individual. To ensure accuracy and safety when assisting with patient transfers, I always adhere to a specific set of steps. Firstly, I would always confirm the patient's mobility status and any specific instructions or precautions outlined in their care plan by the nursing staff. This is crucial as each patient's needs and abilities can vary significantly, especially in a setting with individuals with varying levels of physical capability. I would never attempt a transfer without first being aware of any weight-bearing restrictions, specific transfer techniques recommended by physiotherapy, or any equipment that might be required, such as a transfer belt or slide sheet. Secondly, I would always explain the procedure clearly to the patient before we begin, ensuring they understand what I am going to do and encouraging their cooperation. This helps to alleviate anxiety and promotes a sense of partnership in the process. I would also ensure the environment is safe by checking that the brakes on the bed and the chair are firmly locked, and that there are no obstacles in the immediate vicinity that could pose a trip hazard. Thirdly, I would use proper body mechanics to protect both myself and the patient from injury. This involves keeping my back straight, bending at my knees, and using my leg muscles to lift and support the patient, avoiding any twisting movements. If the patient requires more assistance than I can safely provide on my own, I would always seek the assistance of a colleague rather than attempting to manage the transfer alone, understanding the importance of teamwork in ensuring patient and staff safety. Throughout the transfer, I would communicate clearly and constantly with the patient, providing verbal cues and encouragement, and monitoring their comfort level and any signs of dizziness or distress. I would also ensure they are correctly positioned and comfortable once the transfer is complete, whether they are in the chair or back in bed, ensuring they have their call bell within easy reach. Finally, after the transfer, I would document the activity in the patient's record, noting the time, the type of transfer, the level of assistance required, and any observations made during the process. This detailed approach, focusing on clear communication, adherence to care plans, safe techniques, and seeking assistance when needed, ensures that I can assist patients with their mobility accurately and, most importantly, safely, minimizing the risk of falls or injuries for both the patient and myself.
How would you handle it if you were asked to do a task that you were unsure about or hadn't done before?
If I were asked to do a task that I was unsure about or hadn't done before, my immediate priority would be to ensure patient safety and avoid making any mistakes. Therefore, my first action would be to clearly and honestly communicate to the person asking me that I am not familiar with the task and that I haven't performed it before. I believe it's crucial to be upfront about my limitations rather than attempting something I'm not competent in, as this could potentially put the patient at risk. Following this, I would immediately ask for clear and detailed instructions on how to perform the task correctly and safely. I would actively listen to the explanation, ensuring I understand each step involved, the expected outcome, and any potential risks or precautions I need to be aware of. I would not hesitate to ask clarifying questions if any part of the instruction is unclear to me. For instance, I might ask about the specific equipment to be used, the correct technique for the procedure, or any observations I should be making during or after completing the task. If possible and appropriate, I would then request a demonstration of the task by a competent and experienced colleague, such as the registered nurse or another experienced clinical support worker. Seeing the task performed correctly would greatly enhance my understanding and confidence in carrying it out myself. I would pay close attention to their technique and ask further questions if needed during or after the demonstration. Before attempting the task on my own, especially if it involves direct patient care, I would seek supervision and guidance from my first attempt. I would ask the nurse who delegated the task, or another senior colleague, if they could observe me while I perform the task for the first time. This would allow them to provide real-time feedback, correct any errors I might make, and ensure I am performing the task safely and effectively. This step is particularly important for tasks that involve direct patient interaction or could potentially impact patient well-being. Only after I felt confident and had received adequate instruction and potentially supervision would I proceed with performing the task. Even then, I would remain mindful and focused, double-checking each step against the instructions I had received. If at any point during the task I became unsure or encountered an unexpected issue, I would immediately stop and seek further clarification or assistance from a registered nurse. Finally, after completing the task, I would report back to the person who delegated it, informing them that the task has been completed and sharing any observations or concerns I might have. This ensures clear communication and allows them to follow up as necessary. Furthermore, I would make a mental note of the task and any specific learning points from the experience, so that I am better prepared if asked to perform the same task in the future. My overall approach is always to prioritize patient safety, be honest about my skills and knowledge, actively seek guidance and training, and ensure I am competent before independently undertaking any new task within my role.
Describe a time when you had to deal with a difficult or challenging situation. How did you handle it?
One challenging situation I encountered during my volunteer work at Harmony House involved a resident named Mr. George, who was experiencing a particularly agitated episode related to his dementia. He was usually a very gentle and cooperative man, but on this particular afternoon, he became very distressed, pacing around the communal lounge, shouting incoherently, and refusing any attempts at reassurance from the care staff. This behavior was disruptive to the other residents and was clearly causing Mr. George himself a great deal of distress. My initial reaction was to approach the situation calmly and observe Mr. George from a safe distance to understand the triggers for his agitation. I noticed he seemed particularly fixated on the front door, repeatedly trying to open it and stating he needed to go home, despite Harmony House being his long-term residence. I also observed that the louder and more direct the care staff were in trying to redirect him, the more agitated he seemed to become. Understanding that direct confrontation was likely to escalate the situation, I decided to try a different approach, focusing on de-escalation and distraction. I approached Mr. George slowly and gently, speaking in a soft and reassuring tone. I didn't try to physically restrain him or directly contradict his desire to go home. Instead, I acknowledged his feelings by saying something like, "Mr. George, I can see you're feeling like you need to go home right now. That must be upsetting for you." I then gently tried to redirect his attention by asking him about something he usually enjoyed. I remembered he often spoke fondly about his garden, so I said, "Mr. George, your garden is so beautiful. Do you have any roses blooming at the moment?" This seemed to momentarily capture his attention. He paused his pacing and looked at me. I continued to talk to him about gardens and flowers, sharing some simple observations about the flowers in the care home's small indoor garden. I then gently suggested we take a little walk together to look at the flowers. He agreed, and I carefully guided him around the lounge, pointing out different plants and engaging him in simple conversation about them. This distraction helped to break his fixation on the front door and seemed to calm him down. While we were walking, I discreetly informed a senior care worker about Mr. George's distress and the approach I was taking. She was supportive and suggested we could offer him a cup of his favorite tea once he seemed calmer. After about 10 minutes of gentle walking and conversation, Mr. George's agitation had significantly decreased. He was no longer shouting and seemed more relaxed. We then sat down together, and he accepted a cup of tea. The care staff continued to monitor him closely, and his agitation did not return that afternoon. From this situation, I learned the importance of remaining calm and empathetic in challenging situations, even when faced with distressed behavior. I also learned the value of observing and trying to understand the potential triggers for someone's distress rather than immediately resorting to direct intervention. The experience highlighted the effectiveness of gentle redirection and distraction techniques, especially when dealing with individuals experiencing cognitive impairment. Finally, it reinforced the importance of clear communication and collaboration with the wider care team to ensure the best possible outcome for the resident. This situation taught me to think creatively and adapt my approach based on the individual's needs and the specific circumstances, always prioritizing their comfort and well-being.
How would you prioritize your tasks if you had several things to do at once and a nurse asked you to do something urgent?
If I had several tasks to manage simultaneously and a nurse asked me to do something urgently, my immediate priority would be to ensure patient safety and respond to the urgent request from the nurse without delay. Nurses are responsible for the overall patient care plan, and an urgent request likely indicates a potential or immediate need for a patient's well-being. Therefore, my first step would be to immediately acknowledge the nurse's urgent request to show that I have heard and understood the instruction. I would stop what I was currently doing, unless it was a task directly related to the immediate safety or well-being of another patient that could not be paused. In that rare scenario, I would quickly assess if the urgent request could wait a very brief moment, and if not, I would immediately inform the nurse of the situation and seek guidance on how to proceed, ensuring both urgent needs are addressed appropriately. Assuming the task I was currently undertaking was not immediately critical, I would verbally confirm the urgent task with the nurse, ensuring I have understood the instruction clearly and know exactly what is required, where I need to go, and if there are any specific precautions or details I need to be aware of. If anything is unclear, I would ask clarifying questions to avoid any errors or delays in completing the urgent task effectively. Once I have a clear understanding of the urgent request, I would proceed to complete it as quickly and efficiently as possible, while still maintaining accuracy and safety. I would focus solely on this urgent task until it is completed and I have reported back to the nurse to confirm its completion. After addressing the urgent request, I would then re-evaluate my remaining tasks and reprioritize them based on their level of importance and urgency. I would consider factors such as patient needs, scheduled tasks like assisting with meals or observations, and any other instructions I have received from the nursing staff. If I had been in the middle of a non-urgent task when the urgent request came in, I would return to it after completing the urgent matter, unless another task had become more pressing in the meantime. If I was unsure about how to reprioritize my remaining tasks after dealing with the urgent request, or if I felt overwhelmed by the number of tasks I needed to complete, I would proactively communicate this to the nurse. I would explain what tasks I had been working on, what the urgent request was, and ask for guidance on how to best manage my remaining workload to ensure all patient needs are met in a timely and safe manner. This open communication ensures that the nursing staff are aware of my workload and can provide support or adjust priorities as needed. In summary, my approach to managing multiple tasks with an urgent request from a nurse would be to immediately prioritize the nurse's instruction due to its likely importance for patient well-being, complete it efficiently and safely, and then reassess and reprioritize my remaining tasks, seeking guidance from the nursing staff if needed to ensure all responsibilities are managed effectively and patient care remains the top priority.
Imagine you notice a patient's condition seems to be deteriorating. What would you do?
If I noticed a patient's condition seemed to be deteriorating, my immediate action would be to prioritize the patient's safety and escalate my concerns to the registered nurse without any delay. As a clinical support worker, I understand that I am not qualified to make medical diagnoses or independently manage deteriorating conditions, but I play a vital role in observing patients and reporting any changes that cause me concern. Firstly, I would immediately assess the situation and gather as much specific information as possible about the changes I am observing. This would involve noting exactly what I am seeing, hearing, or noticing that suggests a deterioration. For example, if the patient, Mr. David Miller, was becoming increasingly drowsy, confused, complaining of new or worsening pain in his surgical wound, experiencing shortness of breath, or if their vital signs were outside of their usual range, I would make a mental note of these specific observations. Next, I would promptly and clearly communicate my concerns to the registered nurse responsible for Mr. Miller's care. I would ensure I provide a concise and factual account of the changes I have observed, using the specific details I had gathered. For instance, I might say, "Nurse Sarah, I'm concerned about Mr. Miller in bed 4. He seems much more drowsy than he was earlier, and he is now difficult to rouse. He also mentioned feeling more breathless when I was assisting him with his drink just now." Or, if I had taken vital signs, I might add, "His blood pressure seems lower than his previous readings, and his pulse is a little faster at 110. When communicating my concerns, I would be clear, direct, and avoid making assumptions or offering my own medical interpretations. I would simply state the facts as I have observed them, allowing the registered nurse to use their clinical judgment to assess the situation further. I would also be prepared to answer any clarifying questions the nurse might have about my observations. While waiting for the nurse to attend to Mr. Miller, would continue to closely monitor his condition, keeping a watchful eye for any further changes or worsening symptoms. I would also ensure he is safe and comfortable, for example, by making sure his call bell is within reach and that he is in a semi-recumbent position to support his breathing if he is experiencing breathlessness. I understand that recognizing and promptly reporting a deteriorating patient is a critical part of my role in ensuring patient safety and timely intervention. By clearly communicating my observations to the registered nurse, I am enabling them to make a timely assessment, initiate appropriate medical interventions, and ultimately improve the patient's outcome. My role is to be the eyes and ears on the ground, diligently observing and promptly escalating any concerns to the qualified healthcare professionals who can then take the necessary action.
What are your strengths and weaknesses as they relate to this role?
Regarding my strengths as they relate to the clinical support worker role, I believe my genuine empathy and compassionate nature are significant assets. Throughout my volunteer work at Harmony House, I consistently found myself connecting with the residents on a personal level, understanding their needs beyond just the physical tasks. I am naturally inclined to be caring and patient, and I find great satisfaction in making a positive difference in someone's day, especially when they are feeling vulnerable. This inherent empathy allows me to approach patients with kindness and respect, ensuring their emotional well-being is considered alongside their physical needs. Another key strength is my strong communication and interpersonal skills, developed through my previous retail experience and further honed during my volunteer work. I am comfortable interacting with people from diverse backgrounds and can communicate clearly and effectively, both verbally and non-verbally. I am a good listener, able to understand and respond appropriately to patient requests and concerns, and I am also confident in communicating effectively with nurses and other members of the healthcare team, ensuring important information is relayed accurately and promptly. Furthermore, I am a reliable and dedicated team player. I understand the importance of collaboration in a healthcare setting, and I am always willing to assist colleagues and contribute to a positive and efficient working environment. My experience in both retail and volunteering has taught me the value of teamwork in achieving shared goals, and I am confident in my ability to follow instructions, support my team members, and contribute to the smooth running of the ward. Finally, I am a quick learner with a strong willingness to develop new practical skills. While I have gained some practical experience in personal care and assisting with mobility through my volunteer work, I am eager to learn more and expand my skill set under the guidance of experienced healthcare professionals. I am proactive in seeking out opportunities to learn, and I am confident in my ability to quickly grasp new procedures and protocols and apply them safely and effectively. In terms of weaknesses, one area I am actively working on is building my confidence in handling more complex or challenging patient care scenarios. While I have gained valuable experience, I am aware that I am still relatively early in my healthcare journey, and there may be situations that I haven't encountered before or that require a higher level of skill and experience. To address this, I am committed to actively seeking out learning opportunities, asking questions of senior colleagues when I am unsure, and diligently reflecting on each experience to build my knowledge and confidence over time. I am also keen to undertake any further training provided by the hospital to enhance my skills and ensure I am fully equipped to handle a wide range of situations within my role. I believe that recognizing this as an area for development allows me to be proactive in seeking the necessary support and learning to continuously improve my performance and provide the best possible care to patients.
What are your career aspirations? How do you see this role fitting into your long-term goals?
My immediate career aspiration is to become a valuable and contributing member of your healthcare team as a clinical support worker. I am eager to immerse myself in a clinical environment, gain hands-on experience in patient care, and develop a strong understanding of the day-to-day workings of a busy surgical ward. I see this role as a crucial stepping stone in my long-term career goals within the healthcare sector. Looking further ahead, I am deeply passionate about pursuing a career as a registered nurse. My experiences volunteering at Harmony House and my desire to provide more advanced levels of care have solidified this ambition. I am particularly interested in surgical nursing. I see the clinical support worker role as an invaluable opportunity to gain foundational knowledge and practical skills that will be essential for my future nursing studies and practice. Working directly with patients, assisting nurses with various aspects of care, and observing the clinical environment firsthand will provide me with a deeper understanding of patient needs, the importance of teamwork, and the complexities of healthcare delivery. I believe this practical experience will not only make me a more informed and compassionate future nurse but will also provide me with a solid base upon which to build my nursing knowledge and skills during my formal education. Furthermore, I am keen to learn from experienced nurses and other healthcare professionals within your hospital. I believe working in this role will provide me with excellent mentorship opportunities and allow me to develop a strong professional network within the healthcare community. I am eager to absorb their knowledge, understand best practices, and learn about the different career pathways available within nursing. Ultimately, my goal is to dedicate my career to making a positive impact on the lives of patients. I believe starting as a clinical support worker at your hospital will provide me with the essential groundwork, practical experience, and mentorship needed to successfully pursue my dream of becoming a registered nurse and contributing to high-quality patient care in the long term.
Why do you want to work at City Hospital specifically?
I am particularly drawn to City Hospital for several key reasons. Firstly, I have heard excellent things about the hospital's reputation for providing high-quality, patient-centered care within the local community. During my research, I noted City Hospital's commitment to its strong focus on patient experience and its recent recognition for excellence in surgical outcomes. This really aligns with my own values and my desire to work in an environment that prioritizes the well-being and positive outcomes of its patients. Secondly, I am very impressed by City Hospital's surgical department and its reputation for excellence in orthopedic and vascular surgery. As I am keen to pursue a career as a registered nurse in surgical nursing, the opportunity to gain experience and learn from highly skilled surgical nurses and consultants within your renowned department is incredibly appealing to me. I believe that working in this environment would provide me with invaluable exposure to a wide range of surgical procedures and postoperative care practices, which would be instrumental in my future development. Thirdly, I appreciate City Hospital's commitment to the professional development and training of its staff. I understand that you offer various opportunities for learning and advancement, including a well-regarded mentorship program for new clinical support workers and pathways for career progression within the nursing team, which is very important to me as someone who is eager to learn and grow within the healthcare field. The prospect of working in an environment that invests in its employees and encourages career progression is a significant factor in my interest in City Hospital. Finally, through my interactions with individuals who have either worked at or received care at City Hospital, I have consistently heard positive feedback regarding the supportive and collaborative team environment, particularly within the surgical wards. This is something I highly value, as I believe that a strong and cohesive team is essential for providing the best possible patient care. I am eager to contribute to such a positive and supportive culture and learn from experienced professionals. For all these reasons, City Hospital stands out to me as an organization where I can not only contribute my skills and enthusiasm as a clinical support worker but also gain invaluable experience and support as I work towards my long-term career aspirations in nursing. I am genuinely excited about the prospect of joining your team and making a meaningful contribution to the care you provide to the community.
A patient is refusing to take their medication. How would you respond?
If a patient refused to take their medication, my first and foremost action would be to remain calm and approach the situation with empathy and understanding. It's important to remember that patients have the right to refuse medication, and my role is to understand their reasons and act accordingly within my scope of practice. Firstly, I would politely and respectfully ask the patient why they are refusing to take their medication. That I would try to create a non-confrontational atmosphere and actively listen to their concerns without judgment. There could be various reasons for their refusal, such as feeling nauseous, disliking the taste, being worried about side effects, or simply not understanding why they need to take it. Understanding the reason is crucial for determining the next steps. If the patient expresses a simple concern, such as disliking the taste, I might be able to offer a suggestion like taking it with their juice instead of water, if allowed and appropriate, or checking if there's an alternative formulation available, but I would always need to confirm this with the registered nurse before offering any alternatives. If the patient states they are worried about side effects or don't understand why they need the medication, I would acknowledge their concerns and gently explain that as a clinical support worker, I am not qualified to provide medical advice or detailed information about their medication. However, I would reassure them that their concerns are important and that I will immediately inform the registered nurse who can discuss their medication with them in more detail and address any questions or worries they may have. For example, I might say, "I understand you're worried about this tablet, Mr. Sam. Let me get Nurse Ria for you, as she can explain everything much better than I can." I would never try to force or coerce a patient into taking medication. This is against their rights and could damage the therapeutic relationship. Instead, my focus would be on understanding their perspective and facilitating communication with the appropriate healthcare professional who can address their concerns and make an informed decision about their care. Therefore, my immediate next step would be to promptly inform the patient's registered nurse about their refusal and the reason they have given me, if any. I would provide the nurse with a clear and concise summary of the situation, including what medication was refused. For instance, Mr. Jones in bed 3 has refused his morning dose of Ramipril, and he said it's because it makes him feel dizzy, and the patient's explanation. This allows the nurse, who has a more comprehensive understanding of the patient's condition and medication regimen, to assess the situation, address the patient's concerns, provide necessary education, and determine the appropriate course of action. The nurse may then decide to speak with the patient directly, review their medication chart, or consult with the doctor if needed. I would also document the patient's refusal and the reason given in their care record, along with the fact that the registered nurse has been informed. This ensures accurate documentation and continuity of care for the patient. In summary, my response to a patient refusing medication would be to remain calm, listen to their concerns, explain my limitations as a clinical support worker in providing medical advice, immediately inform the registered nurse about the refusal and the patient's reasons, and document the incident appropriately. My priority is always to respect the patient's autonomy while ensuring their safety and well-being by involving the qualified healthcare professionals who can best address their specific concerns.
You notice a spill on the floor near a patient's bed. What is the first thing you would do?
If I noticed a spill on the floor near a patient's bed, the very first thing I would do is to ensure the immediate safety of the patient and anyone else in the vicinity. This means I would immediately alert the patient and any colleagues nearby to the presence of the spill to prevent anyone from slipping and falling. I might say something like, "Excuse me, please be careful, there's a spill on the floor here," or if the patient was mobile, I would gently guide them away from the area if possible. My next immediate action would be to prevent others from accessing the spill area until it can be safely cleaned. If possible and safe to do so, I would try to cordon off the area using a wet floor sign if one is readily available. If a sign isn't immediately accessible, I would stand by the spill, if safe, or ask a colleague to do so, to verbally warn people of the hazard. This is crucial to minimize the risk of slips, trips, and falls, which are a significant concern in a healthcare environment. Following these immediate safety measures, my next step would be to assess the nature and size of the spill. This would help determine the appropriate cleaning method and the necessary personal protective equipment, PPE, required. For example, if it's a small spill of water, it might be a simple cleanup. However, if it's a larger spill, or if it involves bodily fluids like blood or urine, then more stringent infection control measures and specific cleaning protocols would need to be followed. Once I have assessed the spill, I would immediately inform the registered nurse in charge of the patient or the ward about the spill and its nature. This is important because the nurse is responsible for the overall safety and well-being of the patients and can ensure that the correct cleaning procedures are followed, especially if it involves bodily fluids which require specific protocols for disinfection and disposal. Depending on the nature of the spill and the hospital's policy, I would then either clean the spill myself, if it is a minor spill and I have been trained and have access to the appropriate cleaning supplies and PPE, or I would request assistance from the appropriate personnel, such as the ward cleaner or the designated person responsible for handling spills, especially if it involves bodily fluids or requires specific cleaning agents. If I were to clean it myself, I would ensure I wear appropriate PPE, such as gloves and possibly an apron, and follow the correct cleaning procedures as per hospital guidelines, ensuring the area is thoroughly cleaned and dried to eliminate any remaining hazard. Finally, after the spill has been cleaned and the area is safe, I would remove any warning signs and ensure the patient and other staff are aware that the hazard has been dealt with. I would also document the incident according to hospital policy, noting the time, location, nature of the spill, and the actions taken to address it. This documentation helps to track any potential incidents and identify any patterns or areas for improvement in safety protocols. My priority in this situation is always the safety of everyone in the immediate environment, followed by prompt and appropriate action to eliminate the hazard and prevent any potential harm.